This is Doug Field, CEO of the Institute for HealthCare Consumerism, along with my co-host Ron Bachman, and welcome back to this segment of the program. We're excited to have on our final segment here a good friend of the Institute, a member of our League of Leaders, Josh Hilgers, President and Founder of Health Partners of America. Good morning, Josh.
Good morning, Doug.
How you doing, partner?
I'm doing great.
Great. You recover from forum?
You're trying to.
Hey, I saw an interesting email come out from you recently to the marketplace talking about, where you see the business. Pick up on that a little bit for me. Just tell our audience what you see.
Well, sure. We obviously think that there is, surprisingly, for anybody who has been involved in this industry, and when the Affordable Care Act was passed a few years ago, kind of felt like a punch in the gut. What does that mean for me? What does that mean for my future? We've seen that HHS has been pretty clear over the last year and a half that they know that the success of the Affordable Care Act implementation and guiding consumers to the subsidies and the individual policies that they may qualify for, helping employers understand their new options, that the brokers are going to have to be intimately involved. And so from a private exchange standpoint, which is our core competency, the recent announcement from the CCIIO on how private exchanges were going to be able to interact with and facilitate subsidies available on the government exchanges was very positive. And what it means is that employers, organizations, brokers, consultants can tap into those federal dollars that are going to be available for consumers to purchase insurance on their own websites or facilitated through their own websites that can offer, obviously, a lot more education, a lot more products, a lot more branding and flexibility than a government exchange ever could.
Yes, so get us into kind of the trends a little bit. So how would that work? I mean, with your exchange as an example, how would that work?
Well, there's three different pathways that were announced, and one is an issuer pathway. So when anybody's on a carrier's website, so right now our exchange platform, you can aggregate quotes, see different carriers offering different products, and click on a link and be taken to that carrier's website for application and enrollment. When you're in that application enrollment phase, there's actually going to be a secure link to an eligibility file to see if you qualify for a subsidy. And from that issuer's website, go over, see if you're eligible, grab that subsidy, and pull it back over into that issuer's site. So our sites, as they are already set up to facilitate that. This was a new model. We weren't expecting them to make that pathway available. The other two, and all of these, of course, are the FFE, the federal exchanges, are making this pathway available, but each state is going to be able to say yay or nay to whether they allow that. The other two pathways, one is going to be more of a pure web-based entity is what they call it, where everything happens on that website. So on the private exchange site, it links over, it grabs the eligibility, it pulls it back into our website, so they never leave our website to be able to do it. And then the third pathway is that these exchanges are going to certify brokers and give them a unique link, a unique coding to enter into that marketplace, but be able to get the credit for bringing that consumer and walking them through the process so that the carrier pays that broker, not the exchange, not the navigator. And so those links can obviously be established on our private exchanges as well. So all three pathways that are there, we're pursuing obviously the web-based entities, the more of the effort and the work up front for us, but our ability not only to have the technology platform, but our call center with 150 licensed agents licensed in all 50 states can take the issuer pathway or the facilitator pathway and be able to give brokers that tool, that option in their back pocket as these exchanges come online and become more popular last quarter of this year and first quarter of next year.
Josh, this is Ron Bachman. Question on the subsidies. It's very interesting that you're saying that the federal subsidies for the purchase of insurance are now going to be made available through the private exchanges. Is that right?
Accessible, sounds like, yeah.
as far as each state will have to sign off on which of those pathways they allow, but from HHS and from the Center for Consumer Information and Insurance Oversight, they have made those three pathways very clear and very available.
That's great news. For those out there who may be looking at it more politically, wasn't there a big question about whether or not subsidies were going to be available on non-federal exchanges, that the law really only provides exchanges subsidies through the federal exchanges? So has HHS sort of just ignored that part of the ACA or just redefined it? Because I thought that there was even going to be a problem if the federal exchanges got set up and they weren't state-based exchanges. So now we're saying that the subsidies are going to be accessible through private exchanges. That's a pretty big change, isn't it?
It sure is. Now, what you're talking about definitely was more of a political hot potato. I don't know that anybody really thought that it was more of a technicality, a typo.
Right.
In several places in the bill, they said federal or state, and in one place they just said state and left out federal. And so, that was an opening from a policy wonk to say, oh, it doesn't specifically say it, but anybody that knows this administration knew they're just going to ignore whatever they wrote and do what they said, whatever they want to do.
Do what they want to do, not what the law says.
Right. So I think my impression is that it really had a lot to do with the brokers being invited to participate in the PSIP program, the federal high-risk pool that was created that had very low participation its first year and a half, when they said, hey, brokers, all right, we'll issue you a way to come in. We'll only pay $100 one time, but if you'll help us make this risk pool available to these consumers, help us get the awareness out there, we'll give you $100. And it blew up so much so that they had to stop and stop taking new enrollees. They ran out of money. So I think they said, hey, when we engage these brokers, this thing really works. This thing takes off. And I think they took that success of understanding that the broker's role is critical. And there was actually a survey that came out, I think, 2-3 weeks ago that said over 50% of employers are interested in exchange as part of their new benefits model, but fewer than 5% would trust a government exchange. That tells you a lot right there that if they want this to be successful, they've got to include the brokers in the private marketplace.
Plus that, it sounds like they've addressed the concern that let's say I'm an 100-employee firm. Previously, if I was even interested in a private exchange, how would I deal with my subsidized employees? It was confusing. So now they've clarified that, so I can come and do business with Health Partners of America with my broker, and I can be all in to make sure all my employees are taken care of. Correct?
Absolutely.
Yeah. So how does it work with, in order to determine how much the subsidy is, there's a lot of financial information that's got to be provided. So does each employee from an employer going to the private exchange have the option to request a subsidy? And if they do, then there's a lot of financial information, I guess, goes over and connects to the IRS, and the IRS comes back and says how much the subsidy is going to be. How does that work? That sounds fairly complicated.
Yeah, and that's really where the call center is the big difference. No consumer is just going to be able to pop onto a website and be able to answer pages and pages of these kind of questions without saying, this is too much of a hassle, I'm going to bail out and just not have insurance.
Right.
Yeah, because what is it, Josh, a 50-page application or something
I think they narrowed it down to 4 from...
Yeah, if you're applying for a subsidy, it's still close to 20, depending on how many family members you have. But the way these subsidies work, it's basically an estimate based on your previous year's tax return, and then they're going to settle up with you when you file your tax return for that year that you access the subsidy. So it's still kind of a moving target and not an exact number, but it's going to they catch up with you. They didn't hire these 16,000 new IRS agents for nothing, and they're going to definitely audit and reconcile at the end of 2014. Who did we give these subsidies to? What was their actual income? Do they owe us money, or do we give them more of a subsidy going into next year?
Well, there's going to be all sorts of different kinds of exchanges with different products and services. Sounds like you're really ahead of the curve with all the different technologies that you build into your platform. Tell us a little bit what you think about this being sort of the wild, wild west for a while as we figure out what exchanges work, which ones don't, what services are needed. How's this all going to shake out? And I know we only got a few minutes left, but give us your best overview of where we're going with exchanges.
Well, the two main differences in the models, other than government and private exchanges, the differences in private exchanges are going to be group versus individual. And so if an employer is wanting to sponsor a health plan, meet participation requirements, meet the funding requirements, making the plans affordable. Private exchange group models, which there's plenty of partners that are out there. We are strategically aligned with a few of them, including B-Swift, that can take that enrollment and administration of multiple products from multiple carriers, only one health carrier typically for, definitely for a smaller group, but maybe they want life, disability, dental, vision, and give an online marketplace that their consumers can go. It's really more of an enrollment and admin platform, whereas the individual marketplace, which is where those subsidies are available, is going to be definitely more wild, wild west. We think keep it simple. We're connecting consumers to an insurance product. They need to understand how it works. They need to know that you're going to be there to service it later. If they got a question 3 months from now when they go to the doctor, they want someone to call and answer that question, and they want that user experience to be as simple as possible. And we think that means connecting them with a live human being early. Some of the exchange models that are out there have spent millions of dollars on complex algorithms to have consumers answer a bunch of questions to understand and gauge their risk and give them their top three options. We think if we get on that phone with that person and say, hey, tell me a little bit about your life, tell me about your kids, tell me about how often you guys go, pre-existing conditions, maintenance medications. If we get on the phone with them, it's going to be a much higher participation and a better user experience than them having to answer 15 pages of questions.
Hey, Josh.
So I think it just comes down to helping those consumers, with a live person.
Sounds good, Josh. Listen, I hate to get you off, but it's really, I appreciate you jumping on, and as always, very, very interesting, very informative, and we look forward to continuing this, and I appreciate you being a part of the Institute as well. You have a great weekend.
Well, thank you, guys, and thank you for all that you're doing through the Institute.
Thanks, Josh. Appreciate it. And to everyone, have a great weekend. We'll see you next week on Health.